Thank you so much for the opportunity to come and share this work with you. I'm excited to share it with you. It's my first paper from my dissertation. I'm a third-year PhD student at the School of Public Health next door. So this is the first baby. It's a preliminary baby. So I know it's the first time I'm sharing it with non-committee audience. So we'll be talking about exploring the role of religion and spirituality for caregiving practices, that is parents or primary caregivers of young children in the Western Cape, South Africa, and this is my home country. So we'll start off with the motivation. So religion and spirituality are increasingly recognized as a social determinant of health. Within sub-Saharan contexts, it's near universal. So for example, within South Africa, 3% of the population does not identify with a faith tradition, which tells you that it's pretty salient. It's pretty much everywhere. The majority is Christian with some ancestral faith beliefs or traditional faith beliefs and Hinduism and Islamic faith. There has been prior work that has been done that looks at how religion and spirituality shape the ecological systems within which families operate. That is largely in a US setting and Christian traditions. And I think this is the crux of the motivation for me, is that while this is something that is really important in these contexts, most parenting interventions ignore the role of religion and spirituality on caregiving practices. And so a lot of our programs are designed within secular settings, and they treat religion and spirituality as distal or cultural rather than proximal and familial. And there has been emerging evidence that religious leaders play a role in intervention uptake. So receiving information in Pakistan from your religious leader actually increases your ability or willingness to do whatever information is being shared. And then there is also emerging evidence on a study that has been done in across sub-Saharan Africa on parenting and harsh disciplinary practices. So it is recent. I mean, this is like this year and last year. So recent evidence is showing this. And the baseline is that if we exclude these, it has implications for cultural resonance, the uptake of interventions, and potentially understanding the potential mechanisms that shape these practices. And ideally, like, this is where this work will ultimately go. The first steps are to build this theory of change and try and understand how all of these things relate to one another. So a common framework within, or the leading framework within early childhood development is the nurturing care framework, which consists of these 5 components: good health, adequate nutrition, responsive caregiving, safety and security, and then opportunities for learning. And an increasing number of ECD-centered policies in countries are being centered around this framework. So it's really important within the global ECD, or early childhood development literature. And while it does acknowledge sociocultural differences, it provides limited guidance on how religion and spirituality shape these inputs in practice. The second leading framework is the bioecological model, which I'm sure a lot of us know, Bronfenbrenner. And this acknowledges that children are nested within these socio-ecological systems, but religion and spirituality are not typically explored, particularly in the early childhood and development literature. If we look at religion and spirituality within the child development literature, much of the measurement is using 1 or 2 items. So that would be like, what is your religious affiliation, or how frequently do you attend a service? And that's it. The samples are limited to high-income countries, particularly the US, and focus on a single tradition, particularly Christian. But there is increasing evidence over the last few years. The designs are largely cross-sectional with limited longitudinal evidence, and the outcomes tend to look at children's own cognition and faith formation. So there's some really fascinating work here that's being done around awe and wonder of children. Or they look at adolescents. So adolescent, like risky behavior, like drug use, substance abuse, that sort of thing. And so there's kind of like this mismatch between child's own religious cognition, adolescence, and then there's this missing link of children and the parental influence or the ecological system influence. So we know that there are associations with child outcomes, but they're mixed and sometimes protective for externalizing behavior, and they can be weak or adverse for internalizing behavior. This is a paper that we wrote that is currently under review still. We found 16 longitudinal studies, but mostly high-income country settings and Christian affiliations. And we know that it expands ecologies. What we don't know are specific components of parental religion and spirituality that drive child outcomes. And we need a greater understanding on the specific mechanisms. And we also need to understand this in low to middle income country settings and multi-faith settings. And by multi-faith settings, I mean like people who practice both Christianity and ancestral beliefs, for example, so pluralism. So the overarching conceptual pathway is then parental beliefs and practices and the influence of institutions on the actual practices and how this might relate to leading ECD or early childhood development frameworks. And that would then be grouped as the religion and spirituality caregiving environment, and then how this relates to child development. So the question here is how, if at all, do caregivers in Khayelitsha, this is a township in South Africa, interpret and integrate religion and spirituality into daily caregiving? And this is using a constructive grounded theory approach, which is a qualitative approach. So to tell you a little bit more about our setting, it's multi-traditional, so mainly Christian though, and there is syncretic engagement. So in other words, people do practice both Christianity and ancestral religious beliefs. It's peri-urban, largely informal, mainly female-headed households, high poverty, crime, unemployment, but also high religious participation. Our partner is my former employer at Stellenbosch University, the Institute for Life Force Health Research, and they have established a center. So they've done research in this area for a very long time, and they've established the Masipulisane Community Research Center, and that's where these interviews took place. Objective is to develop a grounded theoretical account of how caregivers in Khayelitsha interpret, negotiate, and enact religion and spirituality in everyday caregiving practices or caregiving for children aged 3 to 6. So our guide was set to understand and explore these experiences in shaping parenting, how these are integrated into routine caregiving, how faith communities and institutions interact with this and their cultural norms. And then we had an exploratory question to look at the perception of including religious and spiritual content in parenting programs and ECD service delivery. So we used the constructivist grounded theory approach because this is a process-oriented question rather than a prevalence or thematic question. And the only difference between this and grounded theory is that it acknowledges the research or co-construction in our meaning or interpretation of the results. We used a theoretical diversified sampling approach across faith, frequency of religious attendance, and caregiver role. We had individual interviews, age 3 of primary caregivers, and that means people who are providing daily caregiving for children, age 3 to 6. We had 2 focus groups, community and faith leaders, which are used to interpret the meso level. And then we recruited in 2 phases. So first, just snowballing within networks, organizations, staff members, and then targeted to try to reduce our gaps in knowledge. We define theoretical sufficiency here at the level of the core categories, which I'll share with you in the results. And to preface, we don't claim within tradition saturation for non-Christian and non-Muslim samples. So this is our final sample, was 28 caregivers, predominantly mothers, so 18 were mothers. 26 out of 28 were female, aged 26 to 69, mainly Christian and Muslim. So 10 were Christian, 7 Muslim, some pluralistic, and 3 non-religious, which I'll share more on too. Also diversity of household composition, so nuclear, single, extended, multi-generational, and including foster families. We had 2 focus groups, principals, which included principals, teachers, imams, pastors, and traditional healers. And these are people that will tend to look after between 150 to 150 children or families at a time, so in their schools or in their churches or mosques. Interviews typically lasted 40 to 110 minutes. Data collection, so 2 data collectors were trained over 3 days on ethics, aim, skills, positionality. That was a big part of our training, and piloting. We were lucky enough that we could do daily debriefs. So at the end of every day, come together, identify our gaps in our knowledge, emerging codes, talk about it, refine our questions, and then begin data collection the next day. Interviews were conducted both in English and Xhosa, which is the local language in Khayelitsha. We did AI transcription and translation using this website called 11 Labs. And I will say that that was for me to, because I don't speak Xhosa fluently, so that was for me to be able to understand the data as we iterated over the data collection period. And then at the end of the entire data collection period, every transcript went to a bilingual researcher who was able to double check the translation. Incentives commensurate with the local rate is around $10, a grocery voucher compensation. Participants were all given free transport to and from the center. There were private rooms for confidentiality. We did our verbal consent checks, and then we also offered a virtual or phone interview option for working caregivers or those who might have safety needs of traveling to the center, because it's not the safest place. And then we also have ethics approval from Stellenbosch and Harvard. So the analytical approach for this is 3 stages. The first stage is an initial, what is happening line by line, and this we did manually in Excel and Deduce. The second stage is what is called focus coding, which is then which patterns reoccur in this data, and we did that through Deduce, which is an online software for qualitative research. And then third, this is what is pictured here on the right, is how do these categories relate to each other and under what conditions? And that is the goal, to get this integrated explanatory model. We also did within case, between case, within tradition, and across tradition analyses. And then the coding team was myself, a master's student at Chan, who is now graduated, and a master's student at the Ed School, who is now also graduated. There are, because it is constructivist grounded theory, we have to be explicit about our positionality at all stages of this, because it's co-constructed. I won't read through everybody's positionality here, but we try to make this diverse. So try to include at least some non-religious people within every point. So I'll share the results of the explanatory process model. So we start off with some prior conditions. The majority of people received, it's the faith that they received when they were younger from their parents or elders. A minority have a deliberate break from what they received from their parents or elders. We then go on to caregiver identity. So caregivers view their children as gifts of a responsibility of stewardship. They anchor in scripture. They also seek guidance from their elders and ancestors. And then the core process of this model is this function here. So there is this inward regulation of the caregiver as a result of religion and spirituality. And as mental health experts, this is what you might be most interested in. So there is this process of emotional regulation, both before you interact with your child and during. There's also this assistance from religion and spirituality in meaning making under structural adversity or even scarcity. It enables capacity, enables caregivers capacity, and it allows people to have routines. So this inward process was also what is then forming the child. So you're first regulating the caregiver, and then this act of regulation is also what is socializing the child. So this is like what is called a dual function, in that what is regulating the caregiver is what is socializing the child. And the main outcomes that we found in our data in terms of child formation are around moral identity, religious identity, cultural and ancestral identity, which was important, and then physical and spiritual protection. In terms of morals, like one of the important beliefs were around respect, patience, kindness, rather than academic outcomes. So academic outcomes rarely featured in our data. Then there are these transmission mechanisms of practicing together. The most common practice is through shared prayer, embodying, modeling, or the caregiver or parent being an example. A lot around disciplinary approaches, so gentle parenting, faith-restrained corporal punishment, and then narrative transmission, scripture stories, ancestral stories, and even technology, watching YouTube videos, cartoons, that sort of thing. The second component, or the second interesting thing to me, is that the children act as co-constructors. So after this transmission happens, these kids are then initiating practices, holding their caregivers accountable, and mimicking and reinforcing faith within the household. So there is this bi-directional transmission process that is happening, rather than this dominant framework in which caregivers transmit onto the child, and then that's it. So that's what is usually framed in the literature, is that there's cognitive transmission from parent to child, and that's it. So we find that there is this feedback. And then all of these contextual conditions will then moderate. So pluralism, so you either choose to integrate multi-faith, or there's an outward rejection of multi-faith. Community and Ubuntu. Ubuntu is an ethos in South Africa that is community driven, and it basically translates to I am because we are. And that came out a lot in our data, a communal camaraderie around raising children rather than it being individualistic. And then gender co-construction. So we found differences by gender. For example, mothers would teach their children a lot on modesty, and that was both related to their religious and spiritual beliefs, but also a form of protection within this context from violence. I can read, so I'll share some quotes from the data. So for example, for ruptures, inverse transmission, a mother says, "Truly, I grew up in hardship. My mother was alive but married, and I didn't know my father. So for my children, I don't want them to experience what I experienced. People took me in and raised me, so I do not want to lack anything while I am raising him." In terms of identity formation, a foster caregiver shares that first it can happen that the child is upset because another hurt them. Then they can come to me as a parent to revenge or fight for them. But according to my faith, there is a place where it says we must forgive those who wrong us. So it helps me teach my child. Fighting back or retaliating won't help you. Even if the person doesn't apologize, maybe they ran away, but you forgive, and you continue with forgiveness. This one talks about, kind of touches on a lot of these points. So when it's difficult, I read my Bible. I still have a mother. Sometimes I speak to my mother. I know that you ask those who are head, the elders, for guidance. So this is elders and ancestral transmission. I pray. I know it's not easy to raise a child in our areas, so we need to pray a lot. There's a lot of things happening, and in my belief, I believe that I'm the one who must pray for him because he's still young. So for him to be protected, I need to pray. And this is kind of going into the core process of regulation of the caregiver. This is a pluralistic, so Christian ancestral mother who says, "Sometimes I feel hopeless. My spirit is down and I have no hope. I feel pain. After praying, you feel your spirit lift. In church, we have group cells. When you're hurting, you share with the people you worship with. You pray together in the group cell, then you feel at least relieved. What was worrying you becomes lighter. Also have a Muslim mother who this will then go into the outward formation, so the dual function. The first thing is what we call sabr, which is patience. So when I'm teaching them, it disciplines me as well. It is something I did not have before I became a parent. This idea that like her teaching her child is also not only teaching a child, but also regulating herself. In terms of transmission, I'll go to modeling and embodying. We are like me and the father, we are like models to them. So it's not strange for them regarding prayer because prayer is practiced in the household. So even the little one, when I'm about to perform salah, she actually goes off. She also stays here with me and she'll just do like 1 or 2 and then off she goes again. And she will go to her father and make salah and then she comes back. This was a Muslim mother. In terms of children as co-constructors, a foster caregiver shares that what I've learned from the side of faith is that we must be examples for our children as parents, because everything we do, good or bad, the child learns. Many times we do things without noticing that the child is watching, yet the child is learning. Then later, as a parent, you come to correct the child in the house and the child points back at you at something you did. They say, but you did it like this. So the most important thing of teaching is the way you are as a parent is what the child learns. And then a mother here talks about, she says, oh, today mom is too lazy to go to church. And I hear, then I wake up and realize the child is saying this, so I must get up and go to church. Yeah, so there are a lot of quotes I could share, but this is the final kind of process in these data. In terms of trustworthiness for this method, so for constructivist grounded theory, there are 4 criteria, and the first is credibility. So sustained engagement. We had sustained engagement. We used both individual interviews and focus groups, and then we did within and across case comparison. We tried to diversify our team positionality and include local input. In terms of resonance, we had a community feedback workshop, local review with the data collection team, and also member checked with our participants. And then in terms of what this is offering, it's offering in terms of originality and integration of ancestral tradition, and it also explores pluralism. What is interesting is that what regulates the caregiver is also what is socializing the child. And then the departure from the dominant cognitive transmission models in which children are seen as co-constructors. So in terms of usefulness for future work, we need to engage caregiver regulation before child formation skills. A regulated caregiver in these settings and household practices are the precondition. We need to accommodate pluralism in our investigation, address children as co-constructors of our religious climates. And then also the next steps, which I'll share on, will incorporate the nurturing care framework components. Some limitations and considerations. This is grounded theory for the setting. It's not claimed to generalize beyond the scope. This is not observational data. These are accounts of caregivers. So we cannot establish anything like temporal precedence. There might be translational effects, which we did try to mitigate with human quality checks. And then researcher positionality influences the results, but we counted this by trying to diversify our team positionality, and we do not claim theoretical sufficiency within non-Christian and non-Muslim traditions. In terms of next steps, thinking about a name for this model, and then second is the goal is to develop quantitative items from this theory of change or theory that incorporates the nurturing care framework components to be quantitatively tested in the setting. And so that is the next step. And then we will do psychometric testing to assess the validity evidence of these items. And then paper 3 will then test this longitudinally to look at child outcomes. In terms of acknowledgements, I'd like to acknowledge the Deborah Rose Service and Learning Partnership for funding and the Winnica Family Public Health Fellowship in the Mississippi Delta. Our partners and collaborators, Professor Yusuf Zay, as well as Mark and Kelly at the Institute for Life Course Health Research, and then our data collection team and analysis team. Thank you.
Thank you so much for your presentation. It's great to have you, and it's wonderful to hear what people are doing over at HSPH. We have a few minutes for a question. I don't know if you, 10 minutes. I don't know if you want to go first since you have to leave.
I need to go. Yeah. So I just wanted to say, first of all, what a fascinating, I mean, I've worked in the ECD field a lot, but I've never actually seen anyone ask this question. It's quite interesting. It's a blind spot. And I think it's a blind spot in all research. And in particular, one could say that in the mental health, early child development space, it's a particularly, a huge blind spot because, mental health is so deeply intertwined with one's belief systems. Mm-hmm. And to that point, I wanted to just say, I remember a long time ago, I won't say how long ago exactly, but I was working in Zimbabwe, and I remember actually being very deeply engaged with the ethnographic literature around African idioms amongst African communities of distress. Mm. And one of the things I was struck by was how the spirit world is not necessarily the same as the religious world. Mm-hmm. And that the spirit world was often described in language and ways that actually intertwined with what I would call, from a biomedical perspective, one's mental health, mm-hmm. or one's minds. People would say my mind is distressed, they would say my spirits are distressed, mm-hmm. and then they would attribute that maybe to what their ancestors did or what they might have themselves done. And there were all kinds of different metaphors, the owl that sat outside my window and the rest of it. You'll see that across Southern Africa. There's a whole ethnography on this. So the question I have struggled with is this true? Are spiritualism and religion, are they part of the same dimension, or are we talking about different things? Because it's very, very common for people who are secular or agnostic to say, no, I believe in the spirit world. I have spiritual feelings. So I just ask you, as you further interrogate your data, is you lump these two together as if they are in the same construct. I don't know whether that's always the case. I'd say my experience in Zimbabwe was that people would connect the spirit world with ancestral beliefs and traditional beliefs, and religion had a whole lot of ritual and structure that went with it. And the mind and the spirit. In fact, I wrote a paper, I remember, called Spiritual Distress. Is this an idiom for mental ill health? The Central African Journal of Medicine, I remember that. So I think it's just worth exploring the ethnography, the anthropology of how spiritual unease is conceptualized. That's the only comment I wanted to make. I can see Laura's got a hand up as well.
First, John.
Oh, sorry, John.
Because he also has a then more.
Oh yeah, no, thanks a lot. That was really impressive work, and I think you shouldn't sell the methods short in your limitations. I think that was actually one of the strongest qualitative projects I've seen. I mean, no qualitative project, it's generalizable, but I really liked your framework. I liked the way you had your analysis set up. I think I thought it was really, really excellent. And I actually want to take some of those approaches to, I have other qualitative projects we're working on. I think we can learn something from this work. So that was just sort of a comment. I really am interested in, we're doing work in faith communities here in the US, and we have colleagues doing this in other countries. I think it's really interesting, not so much in the early child development space, but more in addressing mental health issues more in adults or teens. And I'm just curious if there were, I didn't quite see it in the quotes, but things to do with stigma or misperceptions in these faith communities that came up, and did anything along those lines, and that might be something. Maybe it did, and I didn't.
No, sorry, you're totally right. I think. Can I respond to you first? Thank you, Ron. This is something that I've struggled with myself, and I think the latest definition of spirituality is the looking at transcendence and the power of divine or higher power. And so the reason for lumping ancestral practice within religious, because I think it's more cultural, right? There's like a deep embedding of a cultural aspect. The reason for lumping the two was because there is a belief that ancestors hold a divine power or a higher power over what happens to your child's health. Like whether you're prosperous, whether you get a job or not. There's like this strong connection to them having a higher power. So that's more the reason. But I would, I agree, and I think it would be good to engage with that further. John, to your comment, I wanted to share. Sharing.
It's showing in the Zoom. It's just not showing on the.
oh.
Oh, here it is.
Thank you.
Yeah.
Yeah. Oh, yeah, remotely, right? Yeah, absolutely. Yeah, I'm here in the office. This. Sure, stop by. Perfect. Yeah, I'm here. Yeah, sorry.
Thank
you're about
you.
to say something.
To your comment around yes, there are negative. There are some negative. I would say, or like I called it normative pressure here in
Okay.
terms of there was a perceived judgment.
Yeah,
a lot
or
of
attributing
judgment.
something to do with, I'm just trying, because our work's entirely in mental health, but I'm just thinking, attributing someone's condition or something to negative spirits, or a reluctance to think about getting help, or there's also like the stigma that creates a fear, but it's perpetuated within the faith setting even. And we've seen that it's actually taken a lot of, we've even talked to church leaders, they call it, they have a name they call it church hurt. It actually is almost making it worse for people. This is preventing them. So they're trying to break. That's the words. Maybe others in our team.
Is this in Texas?
This was in Texas, yeah.
I wonder, because I feel that there was, I can recall one case in which there was church hurt, but it was from her not having clothes to dress up to go to church, and she was like kind of feeling she had low self-esteem in terms of how she would be perceived at church. And so I think like the normative pressure is more like around judgment and how you are perceived, rather than relational, which is what I think happens here more, like relational hurt. And I think the difference between relational hurt and like this judgment or perception is because of this like Ubuntu ethos within South Africa. I think it's a lot less individualistic, and that high income countries tend to be more individualistic. It might, that would be my hypothesis.
Yeah, I can't, some of the other places where I've worked, in India, but it's been different. It was in the context of serious mental illness, but sometimes it's misconceptions perpetuated more around faith and beliefs. But yeah, it's really, really fascinating. Thank you.
Yeah, it is fascinating. And I'd love to hear more about the Texas work. Yeah.
Thank you. Sorry, first we'll just go to Laura and then we'll go to you.
I do have to also run. This is really fantastic.
Thank you so much. This was amazing, and congrats on getting this far in your PhD already in year 3. That's very impressive. My question is about what you think the impact of your findings are on the tested ECD interventions that already exist. So I'm curious, especially thinking about our work with BA in Texas, how it's functioning well for people in faith communities, and also BA is very effective with people that don't have any faith traditions at all. So I'm thinking about some of the early child development interventions that have been rigorously tested, like Parenting for Lifelong Health, a number of settings, and like Teresa Betancourt's family strengthening intervention, where there's like BA, like some neutral component, like for family strengthening intervention, they make a family narrative where their values come in and parents can teach their children and tell like the story of our family. And that's part of what they're taught. And then Parenting for Lifelong Health, I know that there's some modules and parts that focus on establishing household routines and norms, and that's where religion can come in. So do you feel like there's more that needs to be done with common ECD interventions that have been tested, or do you feel like they already have a framework where your findings would be able to fit into what exists, and then people can incorporate religious and spirituality into their homes if they need to?
Yeah, that's a great question, Laura. I don't have an answer to that. I will say though that I think like Parenting for Lifelong Health has a South Africa side. I think And I don't know if the question is like, do they need to be adapted, or like how to test the differences between a religious and a non-religious intervention in terms of effects on child development. I think the question for me relates more to within these contexts, would there be better uptake and like better cultural resonance if this component were included? And from our last exploratory question in our data analysis or in our data collection, when we asked like, how do you perceive the inclusion of this content in intervention or programming and ECD service delivery, it was mostly positive. I mean, there were some people who didn't really want to mix beliefs, which is completely understood. But I think it's more, the question for me is more around like, are these interventions really adapted to the context, and or are we just copying and pasting something from like different settings and like testing whether it works? Yeah, but I agree, like that could be future work for sure. And that is ultimately where this will go, but baby steps.
Mhm.
Yeah.
Thank you.
Thank you. It was a wonderful presentation, and I really liked how rigorous the qualitative analysis was. There's a lot to learn from it. I would love to add from Vikram's question, and I wanted to ask how you actually distinguished those who are only doing Christianity or Islam from those who are doing both. Why? Because I come from a similar setting, and lately there is an increase of people paying allegiance to both. For example, there are like things your culture, you're supposed to do in your culture by virtue of being, let me say, belonging to this tribe, belonging to this community, belonging to this ethnic group that you're supposed to do, but then you're Christian. And then what most people do is, yes, I go to church, I believe in the Christian God, but I also have to pay allegiance to that ancestors. And if you don't do so, in some cultures, they think that if you don't do that, you'll get bad luck. So more like to protect yourself from both ends of the coin, you end up doing both. And I do really think that the majority of the people actually are like that. And actually, lately, I've observed like they're trying to match the two. For example, some events that were previously purely ancestral, they are probably the activities that they were doing belonging to just basically ancestral affiliation. They're now bringing a little bit of, if you're Christian, they would say, okay, we shall have, let me say, prayer before we start this, and then maybe prayer somewhere there. And it's like a hybrid of the two. So I'm really interested in what you use to distinguish this, because it seems like it's now the practice across Africa. People are actually doing both at the same time, and they're just trying to figure out how to navigate from that.
Yeah, absolutely. So the lumping, the groups that I shared in the sample, that was self-reported. So that was, how do you identify in terms of your religious and spiritual beliefs? And then what we did was, so they would say, I'm religious in terms of Christianity, and that's it. Or they would say, I'm religious Christianity, and I practice spiritual beliefs in terms, because ancestral beliefs are viewed as the spiritual sector, or like a spiritual rather than religious.
You probably think you maybe, I don't know how you could, because if you ask, let me say me, I would say I'm Christian, right? But if you ask a deeper question, or probably ask about something my ethnic group does, I would say I do that. And that means that there's an overlap. And that's why I asked the question, because Vikram raised an important point, like, is there this thing, like, is spirituality literally the same as religiousness? Or probably,
no.
And if they're different, you're going to find majority of the people do both. For example, like if you produce a child in some groups, there are certain things you're supposed to do by virtue of being, let me say, an African belonging to this ethnic group. And then you're Christian, you're probably going to baptize your child. if you ask this person, are you Christian? They'll be like, yeah, I'm Christian. And then if you ask them, oh, did you do this? They'll be like, yes, we did. And we actually had to do it.
Yes,
And
yes. So
that's
we do
overall.
see that in our data. We do see that, like, so after we asked that question, at the end of it, we had like after you coded this transcript, did this representation of the data match what the participant had said? And it did, because a lot of people do like what is called impepful, which is like an incest, incense burning ritual. They do that along with baptism. So, but then there's also a new wave, particularly among younger parents, in which there's a rejection of pluralism and this idea that you can only serve one God. And so there's like a actual rejection of ancestral tradition beliefs, and there's normative pressure around like family dynamics because you're saying no to your family, which is a hard thing to do, but you're doing it for your religious beliefs. So we see a lot of nuance within this data around religion and spirituality and the differences between the two, for sure. But I agree, it's like it's very difficult because it's so culturally embedded.
Right, true. And
Yeah.
where I come from, that people actually rejecting like Christian names completely. And it tells you I'm Christian, but if you're going to baptize me, you're going to baptize me with names from here.
Yeah.
So it's
it's complicated. It's very, yeah. Sometimes wish I chose like a biological mechanism. Yeah.
Oh, we could do Jason, Cindy, Constance.
Oh, okay. Just like a quick thing. Can I just go back to the slide of objective? Please, I just want to see that slide again.
This one?
Oh, yeah.
Yeah.
I take a picture.
Yeah, sure.
Okay, see you soon.
This is not my area at all, but I find it's just so fascinating based on just my own experiences with my parents adopting religion as they immigrated and acculturated to the States. And, you know, what has been shared so far, really, just how complicated and nuanced it is, but also just really dynamic, I would say, too. And just thinking about what I had seen is this wrestling of what to do, when to adopt things and when not to adopt things. And then also in that process, learning about it as well.
Yeah.
And I think in the church context, there is a lot of sort of exhortation on this is the right way or the wrong way, or what have you, and this need to adopt it because it's so black and white. But that may sort of run into previous beliefs or other things that are important to the individual. And so yeah, I just think it's so dynamic and wondering, you know, it sounds like there's self-report, but I also think too that some people don't know how to appraise this sort of dynamic. You know, I think that it requires a lot of reflection and also ability to recognize that they don't know, they're still wrestling with these things. And from, you know, the kids here are 3 to 6, but, you know, at some point they're gonna sort of experience that wrestling. And I wonder about that socialization process when it's really just not clear cut. It's different than parenting. I think no one gets like a license for parenting, but there are certain, you feed your kid, you know, like you share, like that's not okay, that's okay, that's fair, that's not fair, right? And parents sort of have to create that concreteness for their children. But for something like religion and spirituality, that concreteness for somebody where they're still wrestling with what it actually means to integrate all these different belief systems, I just wonder what it does.
Yeah, I agree. And that well said. I mean, I think within these data, so part of this model is, you know, how these beliefs come from prior conditions. And how it informs the caregiver identity. I totally get your point. I receive that it's dynamic and these things change. And this is a one point in time analysis. And I think what is interesting about these data is that this received faith was actually the predominant view here, is that you kind of just adopt what your parents taught you. And there were very few, it was a minority, which there was a deliberate break away from that prior conditioning. And but I agree, it is dynamic, and like there's you ebb and flow into like how faithfully you practice, and then in some stages of your life versus others. So it is by no means like a reflection of consistency. Yeah.
Awesome. Yeah, thank you for your talk. It was really amazing. Not only the rigorously of the method, but also like the model that you that emerged right from all the switch data. So I loved how it all intertwines, and I was especially surprised, but positively, about the co-creation approach, how children also are co-creators in all this spiritual and religious journey. And that makes me wonder, right, how aware parents, but also caregivers are about how independent, how autonomous, how self-minded children already are, and because sometimes we're surprised, right, by those comments that you also showed us, a child asking for, why don't we go to church? Mother, you have to get up, we have to go to church, right? So how much they're actually aware of the agency of those children, because right, there used to be this idea, this perception that children are only passive beings, that they don't have self-agency, and maybe they develop that further on when they're adolescents or adults. But even when children are little, they already have like their own personality, they have their own preferences, they know what they want and how they want it. So I'm curious just how much you saw that in the data, how much caregivers also appreciate children's own mind and how they shape also their religious practices and beliefs. Yeah.
I think a fair amount recognize that children are not passive receivers, and that they're watching you and they're observing you, and actions speak louder than words. I think there was a fair amount of that. But I think it's very easy to say that once you're reflecting on these questions versus in the moment of like wanting to throw a shoe at your child, you know? So I think they're aware of it and cognizant, but I think our emotions might get the better of us in certain circumstances, and that kind of slips your mind. Yeah. Yeah. Yeah, thank you.
To follow up on what you said, I wonder how, if you recognize the pattern of like parents acknowledging the change from probably how they were raised to how they are raising children right now, because we do understand that the generations are different, and the exposure to information, to a lot of things has changed. At least nowadays, probably the lack of being passiveness is also being probably embedded in the school systems, and where children are encouraged to speak up to their parents and all these things. I don't know if I don't know if that came out in your, and I've also seen parents acknowledge the fact that how to raise a Gen Z right now is different from how they were raised, is different from how I was raised. So I don't know if that came out, and probably if you could also put it out, because I do really think that also raising the child, even amidst like the religious and spiritual influence, which is probably what we are trying to explore here, it also comes with the change of generations. And personally, I remember my parents telling me his hardships, and I was telling him, your hardships are unequivalent. I gave my parents an equivalent of the hardship they went through in my generation. I was like, well, you went to school, you're telling me you didn't have shoes and all this. I'm not going to school without this. I need a laptop. Yes. That is the equivalent of shoes. And it was funny because one time he was telling people that, well, I took back, and I'm glad they didn't take it in a bad way, but I was giving them the equivalence, and this is much more common here, and so I don't know.
Yeah, I think what is interesting about this is that the majority of caregivers in the sample, at least for the setting, there's a strong emphasis on elders and the respect for elders, and a lot of the majority of caregivers actually still call their mom for advice on parenting. And so if you're not living within an intergenerational household in which you live with your mother, or a grandmother is actively caring for your child as well, it's rupture. It's like it's a deliberate break because there was this relational breakdown between you and your elders. But there was in our focus groups, one pastor, a reverend, did allude to like the problems of technology and the gap between like Gen Zs and the older generation, and not being able to identify with each other and relate. And he really, he did. So it did come out for sure. Yeah.
Thank you.
Yeah.
Any other last questions or comments before we wrap up our